Camera rolling, we need the sound?
Want to get the door?
Okay.
We're gonna get the door, Winnie.
Just like this?
That's perfect.
Maybe should I stay out here?
You can stay here if you want.
Okay, if you fit, the oil fit.
Is it okay?
It's the door.
You can come on this side, I think.
Just the extra noise from people walking around.
Yeah.
That'll work. Oop.
Well, there's light. That's really bright over
Yeah,
there.
that's
Okay.
right.
All right, go ahead.
Okay, so are you rolling?
Yes.
Please tell us your name and title.
My name and title is Marie Torres. I'm Senior Vice President of Community... Start all over.
Okay.
Sorry.
No problem. We can cut.
Oh my God. Okay.
You're fine.
Okay.
Okay,
Sorry.
please tell us your name and title.
My name is Marie Torres, and I'm Senior Vice President of Government Relations and Community Research Initiatives.
And what is your relationship to COCC?
We have been a member for more than 10 years, and I'm the primary delegate assigned to the organization.
How did you come to be involved with the consortia?
Well, when we first opened up 11 years ago to venture out into Orange County, this is when we became a member. Ultimate has been serving Los Angeles County since 1969, and so we felt we needed to expand our services to Orange County. We were aware of the coalition, and we became a member and are very strong partners.
Can you talk about delivering high-quality care to our patient population?
Can we stop?
Yeah.
I thought some of these were going to be the medical provider,
Which one is for?
because you're asking some of the questions that
this
the
is the-
providers were going to talk about.
Oh, yeah.
Did you not want her to answer that one?
No, because we
Oh,
talked
sorry,
about the
give me 1 second.
advocacy.
Sure.
I'm going to focus on the advocacy pieces.
There's also
Because you have the
some-
medical provider that's going to talk about quality of care.
Okay. There's also
Yeah,
a
you're right.
backside that has the elected officials questions that are also more advocacy if you'd like her to answer those.
Actually, we will not answer the elected official questions. Those
Okay.
are not, those don't apply to
Yeah,
us.
that's fine.
Okay.
Yeah. So yeah, actually, this is Dr. Flores.
Yeah, Brenda will talk about the quality of care.
Okay.
I was going to talk about what you have, the unique
Let me see.
challenges you face as a healthcare provider, getting patients to.
Yeah.
Did we mark
you.
them?
Mhm,
Okay.
we did, yeah.
Okay, so it's gonna be this one and,
And then we go to that one.
okay. Did you want her to answer this one as well?
That will be Dr. Flores.
Oh, okay.
Yeah.
Sorry, some of these,
I know, it's like Dr. Flores, Dr. Torres.
I know. Okay.
So the bigger, yeah, the broader questions
Is this a T here?
Yeah, Dr.
Flores.
Torres, I think you already asked that
should
question.
be MT.
Actually, no, you
No, I
haven't
didn't.
answered. Yeah,
Okay.
thank you.
Ready?
Go ahead.
Okay. What are the unique challenges you face as a healthcare provider in getting patients to access healthcare in this region?
Well, I think that definitely there's one of the unique challenges is that you have many immigrants who are afraid of leaving their homes for fear of deportation, separation of families, ICE. We are very sensitive to that, and we are a very safe place for them to get care. And that is definitely a primary challenge, as well as individuals in the community that do not know where to get the help. And so we reach out through our branding, our advertisement to make sure that the community knows how to contact us.
Name one example of an advocacy effort that succeeded and why.
Well, we've spent several years working on preventing the funding cliff, and this is where 70% of our funding for community health centers was going to be eliminated. And it was a strong bipartisan effort, congressional effort, where we had definitely lots of time spent to make sure that the funding would be retained. There were a lot of competing demands in DC, and the extension went beyond September 30th, where it was to expire. And I am happy to report that with all the advocacy that we did, and the coalition was leading that charge here in Orange County, with the support of our dignitaries, our Congress members and US senators, we were able to preserve the funding for 2 years. So that's a big win.
And what would you consider to be the consortium's greatest strength and why?
Well, I do think that, well, one of the things that, aside from advocacy, because they're very strong in terms of coordinating advocacy, is that they've been able to really drive the tremendous growth of federally qualified health centers in this region. And so, you know, when we were out here 11 years ago, now there's many of them that have opened up, and they get technical assistance from the coalition, any guidance they need, preparation to become a federally qualified health center or a federally qualified health center lookalike. And so that speaks a lot to their leadership and their visionary work.
What are challenges posed by constantly having to advocate for funding despite consistently demonstrating value?
Well, the challenges have been, first of all, we tried to get long-term funding. We wanted 5 to 10 years of funding. And unfortunately, we were only able to get 2 years. So pretty soon, we're going to be back at it again and do the whole thing all over again with advocacy. And although, you know, we enjoy doing our advocacy, we still want to see a permanent solution. And so it's we're continuing to work with our National Association of Community Health Centers, the coalition, and other consortia around the state and the nation to be able to achieve the permanent solution.
How do you feel the community perceives your organization?
I think the community perceives us in a very positive way. We are reaching many of its residents, our cultural and linguistic competencies for sure. The elected officials here in Santa Ana are very supportive. We have strong relationships with the mayor and the city council members, our county board of supervisors, who are very aware of Ultimate Services and how we are increasing access to affordable, high-quality care and making sure that health care is a right and not a privilege.
And what is your job?
My job. Okay, well, first of all, I have to say I've been here 27 years. I'm very proud to be part of an organization who has a history in social justice and protecting human rights and immigrant rights, caring about people, and the mission of serving underserved communities. That's who I am. I'm leading the charge in advocacy. My background in social work makes me perfect for the role because we care about protecting the patients, we care about protecting funding, services, all of it, to make sure that we have a comprehensive healthcare system that's going to meet all the needs of the patients in a holistic manner.
And why do you, I guess you kind of answered this, why do you do what you do?
Well, every day, just like I said, the joy of being able to grow with this organization so many years, to see that we are over 50 locations in LA and Orange County, serving almost 300,000 patients with staff of over 2,800 people. We are a very large organization, but caring about all of them, as I mentioned, and that motivates me every day to continue doing the job that I'm doing to serve our community and helping them get the care that they need to live healthy lives.
And why is the work of the consortium so important?
It's so important because they are connecting all of us together. We have a large number of member organizations and clinics. They're the ones that keep us together. They're leading the charge. They developed the strategic plan and have had many accomplishments, and pulling us all together as advocacy, in the area of advocacy, and also in the relationship with CalOptima, the County Organized Health System, as a health plan, and having quarterly safety net summit meetings that are very important, and also helping us preserve a clinic seat at the CalOptima Board of Directors level. That's very important to us.
Can you recall any accolades or awards? If so, comment on them.
Well, in August, our CEO, Mr. Castro de la Rocha, will be receiving the Aaron Byrne Award from the National Association of Community Health Centers for his public service. And also he received the Medallion of Excellence Award from the Congressional Hispanic Caucus Institute as well. And we've received many other awards, but I'm very proud to just say that it's part of the visionary work that he and Ultimate have built in this community to be one of the leading, if not the leading, healthcare organization in the nation.
And what is unique about the community you serve?
Well, it's unique in terms of, well, it's I think the making sure the cultural demographics of the community. We are serving the Latino API community, very culturally diverse here in terms of the numbers that are coming to this clinic here, and being aware of their needs beyond healthcare. When they come in and they're having to bring up that they don't have the rent to pay, they're facing homelessness, they don't have money to put food on the table, all of those worries, they can bring that to the clinic and talk about it, and then we, our providers and our staff in an interdisciplinary way, are making sure that they connect the patients to the resources in the community to address all of those social determinants of health, because it's not just about getting the medical care, but all of it, including behavioral health as well.
Okay. Perfect. I think we got them all. Did you want me to re-ask this one because the thing did fall?
Now we can put that sign back in.
Oh, okay.
Because that sign's not moving at all.
Yeah.
We'll just superimpose.
You could do, you
Oh,
could
okay,
do-
okay.
you could do
So
your
yeah.
magic?
Yeah.
Yeah.
Is it okay?
Awesome.
Yeah, we can do some magic.